television or you drive around and see the streets are relatively empty a lot of time parts of the day, and people are doing what we've asked them to do. And I'm real proud. We have had some, as you know, that over the weekend, despite our instructions and recommendations about social distance of 6 feet.
All right, everybody, if you're watching this, the reason why I'm going live, and I'm actually going to share with you the message that's being delivered by Governor McMaster here. So give me just a second here.
Held, dispersed by law enforcement, but then they'd come right back. So anyway, we're making great progress.
What we're seeing right now is we're seeing
issuing another executive order
stopping us from being able to
and you might note
participate in society as Americans are supposed to be.
Is attempt to list all the essential businesses in the state, every one of them, and say
we've been told that it's wrong
will not be subject to closure
go to
or
certain places to be within
those lists are so long
people.
And so confusing that we've decided to do it just the opposite and list only those. The bare minimum.
The propaganda we're receiving right now is worse than the virus.
That are places
what it's
where
going
we
to
know
do to us as individual
has
Americans.
A good place to grow, but also
the amount of suicides, the amount of people that are going to be in lots of debt after this is over with,
close contact,
the people that are going to lose their businesses.
So those are the ones that we're
the fact that many politicians now know of a way to get Americans to stay in their homes.
We could do.
That's never happened before in America.
Come ahead, please.
Good afternoon. Ronald Reagan had said all great change in America begins at the dinner table. So if you would, please pray with me. Gracious Lord, while our hearts continue to grieve for those we've lost due to the virus, I pray that you comfort those families and also, Lord, bring a sense of comfort to those that are isolated and can't have human connection, even with social distancing. Help us as a people to rally around what's been asked of us to keep loved ones and strangers alike safe. May we use this extra time to find ways to reconnect with our families around dinner plates at home instead of hurried meals on the go around home plate at the baseball fields, lacrosse fields, soccer fields, and various activities that occupy our time. I pray we're able to embrace the moment of this pause to reassess priorities, find peace and simplicity, and restore our connectedness around the dinner table. Amen.
Amen. Thank you, Chaplain.
It's always good to pray, but if you believe in God and follow God, it's important for us to tell the truth to others what's going on. And so a lot of times there are prayers that are done by people that want you to give in to tyranny, and
the anticipated impact.
What we heard from the founding fathers that founded the United States of America,
still growing,
the people who were around James Madison, George Washington, and
to stop
those founding fathers was that we need to never fear, because God is on our side. And what we're being told right now is that we should be in a state of fear.
But at the same time,
and that's why we're supposed
not going
to
too far and
not live
businesses
with the freedom
and jobs
that we have. We're giving into government tyranny.
So we're working hard, and since March the 2nd, I've had the law enforcement authorized to disperse groups that are endangering public health. We've required self-quarantine of individuals entering South Carolina from high-risk areas. We've closed public access to the beaches, rivers, lakes, and other waterways, and taken other steps as well. This new order is effective on April the 1st. That is tomorrow, and these are the elements of that. These are non-essential, close contact business and venues where the businesses and the activities are being suspended. Again, this was the bare minimum that we think we can do in closures in order to have the largest impact, and that's the approach that we're taking. So, entertainment venues, there are 3 categories. Entertainment venues that are temporarily closed effective April the 1st are as follows: nightclubs, bowling alleys, arcades, concert venues, theaters, auditoriums, and performing arts centers, and tourist attractions. On the screen there. Racetracks, indoor children's play areas, but that does not include daycare. We want the daycares to stay open if they can. It includes bingo halls, venues operated by social clubs such as Rotary clubs, VFW, and those kind of things, and also adult entertainment venues. Athletic facilities and activities temporarily closed, effective also April the 1st, are as follows. Sports requiring interaction with another person of closer than 6 feet, activities requiring shared equipment, activities on commercial or public playground equipment, and here are the close contact service providers temporarily closed effective April the 1st. Barbershops, hair salons, waxing salons, threading salons, nail salons, and spas. Also body art facilities and tattoo services, tanning salons, massage therapy establishment, and massage services. We have created a group that will be at the Department of Commerce, and it will be for verification and classification of these various businesses that we're referring to. And you can see on the screen there how to get to
there is
them
no
with
authority
email.
in the South Carolina State Constitution
Our goal
for a
is to have a
governor
determination
to
of
be
the
giving orders like this.
decision and verification made
The
within
governor
24 hours.
gets his authority
And
from the
while that
South Carolina State
determination is
Constitution.
being made, that is, if a business calls in and wants to
people
know
of
if
South
they're
Carolina
included in this or not, they should continue
are the
with
ones that
normal
created the
operations until
Constitution
they are so
and they created the rules for the governor and the legislature.
With that,
And right now
Dr.
we're seeing
Bell.
rules being broken.
Thank you, Governor, and good afternoon. As of today, South Carolina has confirmed cases of COVID-19 in 42 counties. This includes 158 additional cases across our state. Please refer to our
If they can do
website
this
for
during the
cases by
COVID-19
county, and that's
event
being
we're
updated
experiencing
daily.
now, they can do it any flu
We are at a
season
point at
throughout
which
the
we
year of any
receive
year.
solemn
Because we
reminders
always get the
daily
flu in
of how
America.
serious
We always
this
have it.
disease is.
It comes in about
It has
October,
challenged
November,
us as
December.
individuals and as a state,
So now these
and it has taken the lives
politicians
of our neighbors and
are
loved
setting a
ones.
precedent
Our response to this
that
public
during
health threat
times where people are
expands
sick,
beyond
they can
institutions,
shut down businesses.
beyond the frontline staff at
They
our
can shut
hospitals and
down
healthcare
anything that they
facilities,
really want to.
and into the homes of every South
Because
Carolinian.
right now the citizens are giving into this.
Thus,
The
it is
citizens are
incumbent upon
allowing
all
this
of
to
us
happen.
to take action to stop the spread of this disease. Last week, we reported on the shortage of chemicals needed
you're
to
watching
perform
this, please
testing
share
for
this, because
COVID-19
especially if you live in South
nationwide
Carolina,
and within
because I'm going to
South
share some
Carolina,
information
including at our
to help you
DHEC
understand
Public
the
Health
importance
Laboratory.
of protecting our God-given rights.
DHEC's laboratory has now the necessary reagents as of yesterday and has resumed a turnaround time of 24 to 48 hours once specimens are received in the lab. Additionally, we continue to work with healthcare providers to stay updated on the availability of hospital beds throughout our state. As of earlier today, hospital beds were reported at approximately 54% of capacity. To date, we have reported confirmed cases of 1,083 reports from our public health laboratory and private laboratories. A great deal of attention is being paid to case counts, and we remind everyone that these are not simply numbers, these are people. In some way or another, the spread of COVID-19 is going to affect each and every one of us. We're all in this together, and with your help, our hope is to minimize the risk for everyone, but we have to focus on those who are at highest risk of exposure or complications and assure that we put all measures in place to protect them.
Which if somebody
The
is
desire
at risk,
for some to obtain
they
details
should
about
remain
where
in their
infected
homes.
people are located has become a
you just heard
disturbing
Henry
distraction.
McMaster earlier. Kids are going to
Because
still
it
go to
suggests that there
daycare.
are still people who don't understand
They're
the
not going to
potential
stop
threat for
that. So
everyone,
there's lots of activities
and
going
that any
on.
one of us can be exposed at any one time, and
that
therefore the
can
need for
transfer
all
the
of us to take
virus.
precautions regardless of the knowledge of where
It's
a specific
unfair
case may or may not
to
be.
shut down these businesses, though.
We're continuing to learn more
not
about
only-
how this new virus is being transmitted.
If you're a business owner and you
and
know
how
this can
long
happen,
it
how
can
much
be
money are you going to
transmitted.
put to invest in your business
Some information gives
to get
us
it going
hope.
again?
For example, the CDC is
It's not gonna be
reporting
easy to restart
some
these
evidence
businesses,
that
but
community interventions are
Are
beginning
you
to
going to
have an
enjoy
effect
being an
in some
entrepreneur like you
locations.
enjoyed being an entrepreneur, knowing that the
There
government can just
there's
stop
also worrisome
your
news
line of
that reminds us
business at any
why
time
these
that it wants to
community
stop it?
interventions must be continued and possibly strengthened. There's growing evidence of possible transmission from infected persons before they have symptoms, and there's evidence of longer than expected spread after individuals become ill. Public health recommendations are being updated based on evolving findings. This emphasizes why details about the location of diagnosed cases is of little
I am
benefit to
thankful
our goal
that
of protecting the
this
population
seems
as
to
a
be
whole.
stopping the
And it
shelter-in-place
can in fact be
order in
harmful
Greenville
if people
County.
are relying on that
Greenville was going to
information
vote
to make
on it at
decisions
4
about
o'clock
what
today,
measures
and it
should be
sounds like
taken.
this event
From the
got in the way
perspective of
their
public
votes.
health
And so
and protecting the public health,
what you're going to start
we are
seeing is you're going
focusing
to
on
start seeing
reducing
Americans
transmission through social
that see
distancing
what
of
these cities
people
can do.
in all potentially
They're
affected
gonna-
areas.
They're going to get
We
out of
won't
these
be able
cities
to
and they're going to
stop
start
all
moving
of
to the
these
country,
infections.
which is a good thing.
At some
We
point,
need
the
more
majority
Americans
of us will likely
moving
be
to the
exposed.
country areas, not living
But we
within the
can reduce
cities.
deaths
The cities
by
have been
assuring that
overcome
healthcare workers and
by
healthcare facilities
very
can
much so
continue to
Marxist
provide
leaders.
excellent
if you go to
care
a city
for those
council
who need it
meeting
most.
and just the amount of Marxist ideas that are
We encourage
discussed
South
at city meetings
Carolinians to
is
focus
just-
guidance
it's
from our
incredible
public health
how we've let city
professionals and
governments
to, whenever
be
possible,
taken over
stay
by people
home
who
and
don't
limit
care
close
about
contact with
Americanism.
others.
Their main concern
This
is
is a
growing the
challenging
taxpayer
time,
base
and it will not end soon.
and growing the
And
the
we're calling on
planks
everyone
of,
across
of,
our state
of Marxism.
to do things that are not easy. Here in South Carolina and across the country, we are now faced with making very difficult decisions about the most effective measures we can take to save lives. Among our many priorities, 2 are of particular focus at this time. The first is protecting those at highest risk of complications from infection. That will reduce hospitalizations and will save lives. The second priority is protecting those at highest risk of ongoing exposure. Our healthcare facilities must be prepared to provide intensive care, and healthcare workers must be protected so that they are available to provide patient care. Yet still, we need to continue to protect everyone. We faced adversity before, and I'm confident that together we can meet this challenge. Fighting this disease will require all of us continuing to work together collectively to achieve the best
And
outcome
what
for all
basically the
possible.
bankers have gotten out of this, and
If we
the
don't do
corporate elites,
this,
they've gotten
if we
trillions
don't follow
of
the
dollars
guidance
from
for
us
social
now.
distancing and staying home,
It's
then we will
it's
see
an
higher
enormous
rates
amount of money,
similar to
and it was
similar
it
to
was
what's
going to
been found
happen
in
sooner
other
or later
states.
because the way
So
we
we must
our economy
all
is
do
set
our
up
parts
is right now,
to
we're going to have
protect one
booms
another.
and busts, and that's because we have
Thank
a Federal
you.
Reserve Bank that issues fiat currency, and we have a government that is turned almost completely over to socialism. So we're going to experience booms and busts. So we were
Thank you,
entering
Governor.
most likely
This
a
afternoon,
bust
we
cycle,
announced
and that's what
a
we're gonna be in
guidance
for a while now,
plan
is a
for
bust
students.
cycle.
We've had many calls about how
the
we're going to handle
elites
graduation,
knew that this is the
grading
time, this
of
is
the
the
materials
crisis
that
they
children are
need
working on.
to get
And
the
so we
bailout.
released that guidance
And they got
today
it.
to our superintendents and to the public, and I hope it's giving some level of comfort and will encourage our students that they do need to work very hard. The work that they've been asked to do will be graded, and we will be putting all of that together in a semester grade rather than 2 separate 3rd, 4th, 9th weeks grades. And for seniors, we need to have all of your work completed by May 15th, and those grades will be put into our Power School system so that we can print diplomas and have you graduated so that you can go on with your life as you move into college or into a career.
Schools are
I had a
schools,
great
a lot of schools are just
conversation
becoming diploma
this
mills.
morning with the district
You're going
teachers
to get
of the
diploma
year.
no matter what.
And
It's
they
no longer the
admitted
tough
that
standards that we used
first,
to have.
when this all was
And this is
announced, they
what
really felt
happens
overwhelmed.
when you give government
But it was so
all the
encouraging
control over
to
your
hear them
schools,
talk
is
about
that you
what they've
basically
learned,
get diploma mills.
how
That's
impressed
why
they
so many
are
kids
with
go
the
to
work that
universities
students
to
are
get a
doing,
diploma,
how parents
but
are
yet they're not
helping them,
prepared
and
for
all
what
of us are
happens afterwards.
calming
That's why
down
you have so many
and really
kids,
enjoying this
college students that
procedure
graduate,
of being
and they're Bernie
home
Sanders
school
supporters.
with the public schools supporting their students.
It shouldn't be a
So I was
surprise
very
that
encouraged by
most
that.
college
I
students
say
these
to
days
parents again,
support socialism.
enjoy this time. There's a lot
And that's
that your
not gonna be a good
students
thing
can learn
for the
just by
country
you
that we
doing
live in.
special things with them. It's the old 4-H motto of learn by doing. But we're in a partnership. We want you to assist your students as best you can so that they can get their work in. And I would like to say to seniors, I am so sorry. I'm so sorry that you're missing out on some things that we remember as lifetime events, proms and ceremonies, award days, and just having time with your senior friends. But you're going to be very strong, and you'll make it through this, and you'll look back on
Seniors
this as
should have
something
had
that made
the
you an
choice to
even stronger
voluntarily stay in their
individual.
homes.
But I encourage you to get your
To
work done, to work with your
voluntarily
guidance counselors.
stay away from other
Tomorrow,
people and
April
and
1st,
businesses.
we will be opening
Mandating this
registration
is
at our
incorrect.
virtual
This is-
school
this
that
is
the Department of Education
unconstitutional.
runs.
This is tyranny, and this sets a horrible precedent in America.
virtualsc.org.
And it's just going to get
A
worse and
number
worse.
of
You're going to have
courses will be
politicians
available.
next year and the year
We
after
think
and the
they
year
are
after
the
that
most popular
that are
courses
gonna
that
try
students would be
to
taking in this final 4
remind people
weeks,
of
like
what they
economics
can
for
do,
one.
because guess
and
what?
we'll also have
The
an
people of
unlimited
America are given into
licensure
this,
for what we
so we're
call credit
allowing a
recovery.
precedent to be
And
set
that's
to
for any
where
student
our
who needs a
God-given
little
right
extra
to the
help
First Amendment,
to be sure that you
the
pass
right
those
to
courses that
assembly,
you need for graduation.
the right to go to
Seniors
an
will
event
have
with
first
as many people
priority,
as we want
and then it
to
will be
assemble.
opened up to other students as well.
We're giving in
That
and allowing
registration
government
opens
to
tomorrow.
say,
The classes
we don't
will
have this
begin
right
on
anymore.
April the 6th.
It's always been a right of
So
Americans
if you need
that we can
assistance
go
with that, you can
wherever
go on
we
the
want,
website
as long as
of
we're
the
not harming
Department of
others.
Education. But Governor, I'll report to you that learning is still going on in South
going
Carolina.
places and maybe
We're
spreading a
feeding
sickness is
over
not
this
harming
time
others.
frame
I
that
mean,
we've
this
been
is
out of
just-
school. We
this
have
is part
fed
of life.
over
Getting sick is part of life.
1,200,000
Getting the
meals.
flu is part of life.
It's been
How many
extraordinary
people have passed
what our
away of
school
the flu
folks have
virus
put together
in the
and how
past
they're
3 or 4
supporting not
months?
only the health needs
How
of
many
our
people have
students,
passed away of
but
other
their learning as well.
diseases
so
that are
we really
being
appreciate
shared?
all the good work and
So what
encourage
we're
our
experiencing
students
right
to take
now is
advantage of this
people are
opportunity
frightened.
and do the best
But how
that you
many
can.
people would be
Thank you.
frightened if they didn't
Thank
watch
you.
the television every day?
Are there any questions?
The mainstream media has gotten people in
the
the
lady here.
mindset to where they are programmed, and that's why they call it programming, right?
And maybe flooding healthcare systems. What's your response to that?
We are
Anyways, I'll
encouraging
let
people who
them
are
talk
not
and-
seriously ill to sort of think twice about seeking medical care if it can wait. And we understand with the pollen, and there are a lot of people who suffer very severe allergy symptoms. They encourage them to use over-the-counter medicines. If they don't have severe symptoms associated with the symptoms that they typically experience with allergies, particularly a fever or a cough, that we want people to decompress the healthcare system as much as possible.
Do we have
Next question.
Do
Ms.
we have a
Adcock.
better idea of when the peak might be, or a new update on the May 2nd numbers? A lot of people are wondering how long they may have to be in their homes with various stay-at-home orders.
Not specifically, because we really are, from our projections within the state, are just several weeks, many weeks into it, but that's a relatively small experience on which to base long-term projections. And so there's a lot more to be learned about how these social distancing measures that are being recommended might flatten that curve or change the expected peak. And we continue to rely on more and more modeling that's being done by the CDC
The
to help us
CDC,
make
by the way, is an
projections.
unconstitutional
Those again
organization.
are at the
They've always
national
been
level
great
and
at
not
misleading
necessarily for South
Americans. They
Carolina.
grow
So we just have to
government. It's made up of
continue with our
leftists
social distancing measures
that hardly get
with the
anything
knowledge
right
that
with their
those
decisions.
will
And they force,
ultimately change
what is
the
it,
peak,
about
but
70
we can't make any
vaccinations on
predictions
kids
in
now
any
before they
way
turn
about a
18? So
particular
we're going to
date
listen to
when
the
we might expect that to
CDC
occur.
on what they are telling us.
Businesses stay closed?
We've
Ma'am?
become a
How long
gullible
will
people
your
is what we've
executive
become.
order-
Well, it runs for 15 days.
So it's time to
by
stand
state
up,
statute, and it will go that
learn the
long. We
truth,
can
teach the
change
truth,
anything in there if the
and then
conditions
the truth will
change prior
prevail
to
once
that.
we start
But
speaking up
that
about
is
what's really
that's
going
the
on.
tenure of an executive of a declaration by the statute, 15 days. Next question.
Governor, you said you
Yeah,
want-
Right back in the back.
Yeah, Dr. Bell, you said at some point a majority of us will likely be exposed, but you also said the desire to obtain details about where people are located with as tested positive for COVID-19, I assume is what you meant, has become a disturbing distraction. Why would that not be relevant information?
If you're watching this,
to try
please
to
share it.
prevent the
We
spread
want
of
people to
COVID-19,
know what's
have
going
more
on. We want
detailed
people to
information,
join the South
especially
Carolina
with
Citizens Group for
healthcare
God-Given
workers
Rights.
to potentially be
We
exposed.
actually have
Why
a phone
wouldn't that
call
be
at 6
relevant?
o'clock this evening.
Because it ends up being false
Anybody can
information,
dial
if
in and
people
join
rely on knowing about a specific address or a specific location if they're trying to use that information about making decisions about how to protect themselves. We got disturbing information from social media that people were reporting that I'm in a safe neighborhood, no reports here, that kind of thing. And I can't help but ask the question, does that mean that they're going to modify their behavior in some way because they believe they're in a safe community? Very early on, the CDC predicted that the majority of us, either in this season or in the following year, will ultimately be exposed.
We're taking our orders from the federal
So
government.
if people are
The
trying to
CDC,
use
which
very
is
specific information
very rarely correct,
about making
and it
decisions
does a lot of
that
things that
their
are extremely
community is
bad for the
safe
American people,
and that they should not
that's
observe the recommendations,
that's the
then it
instructor
becomes
for us
harmful
right now. That's who we're
information,
teaching.
and
That's
it
where
creates
we're
a
learning
false sense
from.
of security.
What
We
about
as
the reverse
Americans
of
have got to
positive
become
tests?
independent
'Cause
thinkers.
you're talking
again.
about the negative part of it, like, oh, my community's fine, no one in my neighborhood has it. What about the reverse? If
What do you
people
mean by the
testing
reverse?
positive, I know you have the zip codes put out, but say certain buildings or facilities, whether it's healthcare professional workers, we saw MUSC had 34 employees that tested positive for COVID-19. That just came out, but there could be others within the community, other healthcare facilities that have tested positive, but we don't know if anyone in that facility has.
So that's why we focus on the close contacts of known cases to take more measures for isolation and quarantine of the contacts of known cases in high-risk settings, like healthcare facilities or congregate settings. If your question, if I understand you, about what does the public know? So for example, in a grocery store or something like that?
Yeah.
Because the measures are the same, we don't consider everyone who's been in a large public gathering to be exposed, and that's why we recommend the community measures. The other thing that we need to point out, though, is as we learn more information about people potentially being able to spread when they don't have symptoms, and the reliance on diagnosed cases and where those reported cases are, it ends up having people miss the picture that there are unrecognized cases everywhere.
Which is always the case when you have a
And
flu, right?
therefore,
The flu
they
gets
have
spread
to
around by
practice those
people
measures
who
regardless
you
of what they
A lot of
know
times when you have
about
the flu, you're
a
not the
specific
carrier to the
case at a
flu.
particular point in time. Spread is ongoing, and we all have to take precautions to protect ourselves, no matter what we know about an individual case. It ends up being misinformation.
Governor?
This gentleman, yes, sir.
You said you want daycares to stay open if they can, but you already close schools, and daycares tend to follow schools' lead. I mean, why keep daycares open?
Because there's a great demand, people need daycare centers, and they depend on them, and they can't work without them. So we'd like those to stay open within the kind of limits that have been pronounced by the health authorities, the CDC and others, like people need daycare centers. Yes, ma'am.
Governor, people are reporting coronavirus scams online, asking for their address and money. How can people distinguish what is a scam and what is not?
Well, I'd say listen to law enforcement. Don't trust anybody that calls you up on the telephone or emails you with that kind of information. Rely on the websites. We have virtually every state agency has a website that has coronavirus information on it. Go to that.
Now, why do so many people need
daycares? They're updated. They're highly professional.
It's because
they're
of
easy to
taxation
use,
in
and most
America.
of them refer to the others.
Taxation
That's
has
the
been
way to find
purposely,
your way
the
around.
income tax,
Just
the
like
property taxes
always,
that we
there are
have
people out there,
been put in place
unscrupulous
with
people, that will
purpose
try to take
to get
advantage
it
of
where
the situation.
the average
This is
American
one of
family
them.
cannot
And to the
afford
extent that we can
to hire
catch
somebody
them,
or
I'm
to
sure you
even
that they
leave
will
a parent at home,
understand
a
that they have,
stay-at-home mother.
broken the law.
They
And
can no
the
longer
Attorney
afford
General,
to
by
do
the way,
that.
I think
And
has
that's
over
why these
500
daycare
complaints
centers
or so
are considered
of
essentials
price
because that's
gouging,
the
and those
situation we
cases
have
are
in
being
America.
addressed or investigated at this
And
time.
I'm not
Does
advocating
that
for
cover?
daycare centers being closed down.
Order and why
but
you didn't do it sooner, and
If
if you have any
this
idea how
virus
many
is
of
so
these
bad, why wouldn't
businesses
we shut
are
down
still open?
daycare centers
Well, a lot
as
of
well?
these businesses probably are not open. We know a lot of gymnasiums
What's
have
the
closed
difference
up.
between
a lot
a
of,
gym and a
lot of
daycare
businesses
center?
that have taken it upon themselves
There's a
to
big
go
difference,
ahead and
but
close
adults
for
at a
number of
gym
reasons.
or
One
kids
of,
at a daycare center, you're still
which is
getting the
they
coronavirus
don't
spread
want to be a
around.
source of spreading the virus
So
or a
my
location for spreading the
desire
virus.
to remain
And another
healthy
is
and
there
go
are
to
no
a gym
customers coming
is
to
not
come to
essential
see them,
anymore.
so
You know, my
wise to
desire to go to the
close
barber
down.
shop and get a
But
haircut
the
is
timing
not
of this is
essential.
our hope
barbershops are
from the
being closed down.
beginning
Hair
and the
salons are being
procedure that
closed
we
down.
established, the
Your local
structure that
gyms
we've been
closed
following,
down.
is to do the things we need to do that are best things to do based on the science, the facts, the recommendations and advice of the experts in the field and the data.
What happens when we
And
realize
it
we're
has
getting
been
bad
mentioned
advice?
that the CDC
How many
is
trillions
now-
of dollars
is
are we
said
going to
that
bail out
it
these
appears, if I
government
understand it
elites
correctly,
with?
that the
Before we
one
figure
can
out
have
we're
the
getting
virus
bad
and not
advice.
show symptoms for up to
And
48
the
hours and
real
still be
thing we
able
need to do is to
transmit
remain
that
healthy as
virus.
Americans. We need to
That
take
is
our
that's
vitamins.
a little bit of a movement
we need
of the
to
bar there by the
treat,
CDC.
do
But
preventative
also
measures
we've had,
for
as I mentioned earlier,
certain
we've
things,
had a lot of
allergies.
great
There's,
cooperation all over the state. but
some
in
people
some
will eat a
places
bowl
there
of
has
garlic,
been a lack of
every day.
understanding
I've done
of the
that the past couple
seriousness of
days.
this, and that's why we're having
just
to
to relieve
move
sinus
forward.
symptoms. A
But
lot of people
also
now in
these
South Carolina
businesses
have
that
sinus
we have,
symptoms
and
and
activities
they think they
that
have
we have
coronavirus,
focused on
which,
here are
due
those
to
that
the
have
panic right now,
high contact.
you can imagine the fear people
in-
have because at the same
sometimes
time they're
in
hearing
very,
about the
very close
coronavirus,
quarters,
they themselves
but
are having
that
trouble
are,
breathing because they are
not,
suffering
as
allergy symptoms.
essential as other
which in South
businesses
Carolina
to keep the
is very
economy
common.
going. Although it's essential for the business, we know that, and that's one of the regrettable things about this is that there's going to be some dislocation as we go along. We're hopeful that the federal authorities and what you've heard the president and others announcing are going to provide some financial assistance
If
in
you're
those
watching
areas.
this, please
But
share it.
These particular ones,
gonna do
I
my
think
best to
we
provide some-
probably have a
Right now, a lot of
smaller
people
list.
are
We've
wondering
whittled it down to
why
where we
there
thought we
aren't
could get the
assemblies of
biggest
people out
impact
in the public
in-
eye,
with the
you know,
least
raising
disruption.
awareness about
I know,
this.
we know
and
it's
they're
disruption
wondering
for
if
a
there
lot
are
of people,
others that
but
are
we think that in our
upset about what's
approach,
going
which
on
is
in the state of South Carolina.
maximize our efforts
And
aggressively
this is our
against the
opportunity
disease
to
while
use
attempting
the
to
internet to
avoid
spread the word
all
that
but
there are
necessary
people
dislocations
who
is the right
disagree
path
with
to
what's
follow.
going on in our state.
Yes, sir.
So are you basically
I know there's
telling
probably
people
some
to
people
stay
from
home
outside
if
of
they don't
South
need to go
Carolina
out?
watching
We've
this.
been saying that from
And
the
you've got
very
the
beginning.
same
is
feelings about
stay
what's
home.
going on in your
We
state.
had it on 77 of the electronic signs on the highways. I think everything we've had, we said, stay home. And a lot of people are staying home, and that's good. Because there's a lot of people don't get to stay home sometimes. This is,
Follow up on that, sir.
but
It's a good
we've been-
question. Are
the
they
things that
practicing
we
social
have been
distancing right there? It looks like he's
asking people to
within.
do.
Well, maybe
are
there's
the-
6
are the
feet
things
distance,
that
but
the experts, the data,
getting-
the
he's
science,
getting very
and the
close to
knowledge
breaking
of
his
the
own rules
experts
while he's up there at the
experience have
podium.
shown work. And if people will,
But that's
will
always
do
the
those
case, right, with
things,
government
then we'll
people who
get
create
through this
these
better than we will if
rules
they
that
don't.
go
'cause this
against
is
our
a
God-given
dangerous
rights. They get to
disease.
break the rules,
Follow
but
up
we,
just
the
for these essential
people,
businesses that
we're
are still open. Do you have any
supposed
advice
to
for
live
them?
by
It
the
sounds like
rules or
some
we get
places
fined or
aren't
put in
doing the
jail
best to
or,
keep safety measures in place
you know,
for
other
people
things
that
can
are
happen
going
to
there.
us too.
Is there any advice that they should be
can't-
doing? Safety measures, should they be
Every-
sanitizing more? What should they be
every-
doing?
Every business should be following the recommendations and advice that have been explained time and time again here, from social distancing to keeping things clean. We ask the businesses to open early for some of the seniors to avoid the crowds, and the seniors are taking that advantage of that and actually flooding in. All of these things that we've been urging from the beginning, there's some things that you can't make somebody do. You can recommend, but I think as the virus is spreading, and we've seen dramatic scenes in other parts of the country, we don't want that to happen here. And we have people that
But are they
understand
really
that,
dramatic scenes, or
good
how many of them are
neighbors,
actually being made
they're
up?
smart, they're disciplined.
we're
and
seeing
if
a lot of
everyone
propaganda.
will follow these
For
rules.
instance, I think
And I've
yesterday
got
they were
confidence
using
in
the
people
Italian
in this
hospital
state. If everyone will follow these
pictures
rules
to
and these
show an American
suggestions, as Dr.
hospital,
Bell and others
and it
have-
was total
have
propaganda
pronounced,
trying to get
we'll come
people to
out
panic
of
in
this
America.
much better than if we don't. But it's
The
nice
nice thing
over
is
yet,
we're
and
getting
it's
ready to
gonna
hit
get
the
worse
summer
before it gets
temperatures,
better. Yes, ma'am.
and the
Is that
virus
right?
will
Does this differ any
go
from the
away.
stay-at-home orders that cities and other localities are doing, and if so, how?
We are not ordering people to stay at home, but from the very beginning, we've been telling people to stay at home, recommending it. Everyone just about that's spoken here has said that. But, and a lot of people are staying home. Yes, sir.
So you keep saying that you're trying to do maximum efforts with minimum damage, it sounds like, from
That's
an
right.
from an economical standpoint.
But some damage is
Unavoidable.
unfortunately necessary.
No, I understand that. So, but you keep saying you're only suggesting right now to stay at home. Why not just issue the mandate or shelter in place, as we've seen,
'Cause
people
that's-
not listening
that
completely?
is-
You look at the beaches in
No,
other areas.
that's what most people are already doing. The spots that needed special attention were the beaches and these other areas that we're talking about now, that we've addressed in this order. Yes, sir.
So, I mean, we're learning more and more about
See how the
disease.
media is
there any
pushing the
worry
shelter
that
in place?
People who prepare our food, restaurants, takeout places.
Most
that-
reporters these days are
Is
Marxists.
there any guidance for them?
And they're very
if
well
they're-
organized.
can they
They've got an
spread this,
agenda.
the disease without showing
And they're not
symptoms?
happy with
And why not
politics
close
right now because
restaurants if,
Americanism has been
if that
growing
may be the
in
case?
America.
Not
And so
really.
they see this as an opportunity.
Well,
If they get shelter in
we're-
place going
we're
all over
still
South
focusing
Carolina,
on, I guess,
what an
the
opportunity it is
maximum
once the
benefit with the minimum
business,
disruption.
there's
And
going to be a
there
second bailout, a third bailout, a
There
fourth
is the chance
bailout.
of asymptomatic
And
transmission.
pretty soon
that
we will
if
just
we're looking
transition
at
to
a
full-blown
restaurant worker,
socialism.
And there are
You get
restrictions
your
in
government check,
people
you stand in bread lines, you
getting
stand,
food service
you
in a
stand to get your
facility
toilet
if there's
paper.
curb service.
There's
And
no
we've
longer the
reduced
efficient
the
free
risk
market system
of,
that we've had in America.
Face-to-face contact
It's
and things
this
like that,
close.
and we're continuing to take measures
And that's why they're
to
pushing
reduce
for
the probability
this
of
to
exposure. We can
continue
never bring that to zero.
to get to what
and
they're
we
going
can't
for.
do 100% isolation, so we focus on the efforts that are the highest yield in preventing people from being exposed, and focus on protecting those who are at highest risk of having complications. And we focus on those who are expected to have ongoing face-to-face exposure with people who are sick, as opposed to a restaurant worker. It's a difficult balance, because we still say that the majority of the people in the population overall are well. There's a random chance that anyone at any time can be exposed. And so you have to balance that as much as you can, limit the possibility of exposure to protect everyone, while also trying to protect those at highest risk for ongoing exposure and the most serious complications.
But while you're up there, Dr. Bell, is DHEC tracking the number of hospital employees across the state who may have tested positive?
Not in a specific occupational category. So healthcare facilities are aware of their healthcare workers who are positive, and they are monitoring those and allowing those to come back to work as appropriate when their symptoms have resolved or depending on their healthcare needs. But DHEC is not monitoring hospital workers any more than we would in any other occupation as to the number who are currently ill.
Is there any special guidance you're giving the hospitals if they have
Yes.
an employee? And what type of guidance are they getting?
It's information that's posted on the CDC website. We've provided them guidance about how they should measure.
And just so everybody knows,
how they
the
should
government
monitor
basically
employees
controls hospitals
who
now
are not
because of
ill, monitoring those entering
Medicare,
a facility,
Medicaid, Obamacare.
and how they can make decisions about return to work for those who have
So
been
if
diagnosed.
you have a hospital in your
And so
area,
that-
it's
that
likely
guidance has been disseminated in our health
is-
alerts, and we're in
is-
direct
is very
communication
political.
with healthcare facilities regularly.
And so
to
they're gonna
provide that
bow
guidance,
down
and we
to the
consult with them
government
on a case-by-case
politicians
basis.
upon any
And
orders
that-
because
And that-
they're
I
basically
spoke
a
with a couple
government
of state
entity
district
at this point
representatives
because
today,
we've destroyed the
and
free market
they've
system.
been monitoring the executive
Uh,
orders that have been put into place,
in the medical
Governor,
field.
and
Not
one
entirely,
told me
but
that
it's very close.
almost a piecemeal as we go data by data. As you said, you wait for the scientific data to come in before you issue an executive order. What data are you waiting for before maybe issuing a mandate for stay-at-home or a shelter in place?
Listen, at this point, whether it's an order to stay at home, a recommendation to stay at home, a suggestion to stay at home, whether it's written, whether it's oral, if there's anybody out there that does not know that they should stay at home, then we've really been missing something. People should stay at home as much as possible. They're going to need to go to work.
So this reporter's really trying to get Governor McMaster
to
to issue
Yes,
stay-at-home
ma'am.
orders that come
Reiterating my
with
colleague too much,
fines.
but you said this executive order will continue for 15 days. If it continues to get worse, is there a plan in place for that? Will you close more businesses after that?
We will take these situations as they come. When we issued
How many
when I
more
issued the
businesses are there to
first,
close? I'd like to ask the reporter
declaration,
that. I mean,
emergency
we
declaration,
basically just
we
have
knew there
open
may
our
be a
places to get our
second
groceries, our
because
places
of
to go
what
to
has been
go see the
described by
doctor.
the science, by the data, by the experts as the course of this event and when it would peak and so forth. It is likely we may have to do another one. But that depends on the circumstances, the facts, the science, and the data when we get to that point. Also, things change in between. As I say, the CDV view of things has changed and has evolved with this new disease. There are new factors coming in all the time. But what we have a steady plan to see to it that we're going to be prepared for the people of South Carolina. Right now, we're as prepared as any state, maybe more prepared in getting our hospital beds and those sorts of things available. We've been working as a part of our plan to see that that is done, and the National Guard and the FEMA and the hospitals and all are working together on a plan, and it is being implemented now. Yes, ma'am.
I have a question actually for Dr. Bell. Are we getting numbers from our military installations, and are we including those in the state numbers? Are they included in the county numbers?
I'm actually not sure about, so you mean diagnoses made on military facilities in
Correct.
Fort Jackson? I can't answer that right now, but we can get back with you. There are reportable conditions within the state, and all providers and laboratories are required to report these cases to DHEC.
Dr. Bell, can you elaborate on the 22 deaths we've seen so far? A lot of them primarily have been elderly and with underlying conditions, but I think you guys just reported the first death of a middle-aged person today. Can you elaborate what we've been seeing as far as people who have died because of COVID-19?
The picture that we've seen in deaths in this state follows the expected pattern that the majority are in older individuals with other underlying medical conditions, but we also know that younger people who also have underlying medical conditions can be more severely affected, and that in fact anyone in any age group can unfortunately can die.
Now, what happens when all this government propaganda goes away, this deep state media propaganda goes away, we realize we've been had by these people that are controlling our governments,
for people in
controlling our
the
media?
general
What's the
public to
next
wear
step?
masks for several reasons.
That's something we all need to be thinking
The
about.
first is what I've alluded to, that
They're destroying
at any
our
one point
businesses.
in time,
They're
the
making it
majority of
hard for a
people
husband
in
and
the
wife
population in
to
general
raise
are
a family
actually
right
well.
now. Yeah, there's going to be
There
bailout
are,
checks, but it's
there
not
will always
much.
be sporadic
And
cases of
certainly
people who are
life
ill,
after this is not going to be
and so
the
that's why we
same.
do social distancing. And the other most important
Some jobs may
feature
not be there
or
for people
fact
once
is
this is
that,
over with. They
that
may have had a
personal
great
protective
job
equipment
before
is
the
in
economy
very,
went
very short
down,
supply.
and
And
now
so
it's
if the
time
general
that
public
they
begin
go back
using
to the
masks,
same company,
that
and there's
depletes
no job there
the
anymore.
supply for healthcare
So they stay on
providers
unemployment,
who
and
every single day in all that they
the
do
road
are
to
expected
serfdom.
to
That's
have
what we're
direct
experiencing right
face-to-face
now.
contact with people who are sick.
Hayek
And so
wrote
therefore
about
they are
this.
at the
The Road to
highest risk of
Serfdom.
exposure.
Great book to
And the
read.
general public should not be depleting
If you're
those
watching this, you want to
supplies
read a
for
great book,
the
read The
possibility
Law
of
by
some
Frederick
random exposure.
Bastiat.
They should practice
The
social
Law
distancing.
is one of the essential books to understanding what liberty is and how to exercise liberty, and what governments are their only duty is to protect our liberty, our God-given rights, our life, protect our life, our liberty,
The
our
CDC also
property, and our
has
pursuit of
guidance
happiness.
for
That's all
funerals and for
governments are
funeral
supposed to do.
directors. And,
Once governments get in the
and
way
they
of that,
work with families
they're
on an
no
individual
longer
basis to make these very difficult decisions about
American
having
governments. The
family
governments have
gatherings
become
during
corrupt.
a life-changing event. And so that information is available from the CDC, and DHEC has provided that to funeral parlors.
Governor or Dr. Bell, because there are 30 cases, there are more than 30 cases at MUSC, do you think hospital workers are being protected enough?
Well, there's a serious concern about the availability of personal protective equipment to satisfy the expectations of healthcare workers, and we're continuing to work at all levels, with the federal level, our Strategic National Stockpile, with the Hospital Association, and others to supply that demand.
Is DHEC trying to buy PPE on its own?
Yeah.
Hi, Nick Davidson, the Acting Director of Public Health for DHEC. Indeed, as Dr. Bell and others have said, we're first working and have been actively working with the Strategic National Stockpile, which is that federal resource. We expect another shipment in. We received some yesterday, a part of that shipment, and the rest as the week goes along. And we expect to begin distribution of some of that materials with
every government
our
employee,
partners here at Emergency Management.
they're going to be getting their paychecks.
And our partners in the Guard as well. We are using state funds to begin to purchase those
Small
as they become
business
available.
employees,
Some of those supplies, as many have
large
said,
business size
have been
employees,
hard to come by. But we do
collect
have state
unemployment.
funds
Once that
that we're very
unemployment
appreciative to
goes
the
out, the
legislature
economy
and the
may
governor
not be
for,
there like it's been
that will
there.
allow us to purchase some of those some of those supplies as they become available. So
And
absolutely,
in
and we'll
my
be
viewpoint,
distributing
it was
those
probably
in
all
probably a
orchestrated
similar
because
manner
a lot
as
of us
we've done
could
the
see this
Strategic National
coming.
Stockpile supplies.
Our
Are you bidding
economy
against
is going to
other
have
states?
booms and busts
sorry?
because the
Are you
way it's
bidding
set
against
up
other
with the
states
Federal
for
Reserve
these
Bank. The
materials?
Federal Reserve
No,
Bank
it's not
is
an
a fake.
active bidding process, but certainly it is a supply and
it's a
demand
fake
issue.
federal
So,
group. It's not
so
federal.
yes, it's a
And
challenge
there's
for
actually
everybody at this
no
point in time to get
reserve
many
that the
private
bank
supplies,
has.
but we're working actively to do so.
Total.
Dr.
It's a-
Bell, for those at
it's-
home, you mentioned
it's a
underlying
total farce.
conditions, and I know we've
It's
spoken
nothing
about it
like
time
what
and
I
time
thought it
again.
was when I first
So
learned
the
about a
first
Federal
part
Reserve
is, can
Bank.
you describe to
So
people
we're
at
gonna have
home
these booms
what
and
type
busts.
of underlying conditions are we talking about
But
that
what
may
the
make someone more
bankers and the global
susceptible
elites always
to
get
being
during a bust
infected
is they
with
get what they want.
COVID-19, and also
They get the
how
bailout, they get
confident
the
are you
wars
right
they
now
want.
in the system and the
So
measures
just
in
be-
place
just
for
prepare-
testing? I know I spoke
prepared
with a
for
woman
what
from Camden who's on
is
day
going to go
9,
on the next few weeks
waiting for her
because
results to come in.
they have the media
Yes, and
under their control.
these are conditions that it
And they
does
have a lot
not
of
make
government
people more
officials under their
susceptible to
control,
being
too. So you're going to have
infected.
to be an
It
independent
makes them
thinker.
more
You're going to have to
susceptible to
think for
having
yourself.
severe complications if they
And
get
realize
infected.
that
And those conditions
you
are
could be fooled
chronic
if you're not
lung disease,
learning from the right
heart
people.
disease,
I
diabetes,
learned from the John Birch Society.
any
I now
condition
work
that
for the John
weakens the
Birch
immune
Society.
system.
Why was it
and,
important for me to
diabetes,
become a
and
member
that
of the
is in
John
any
Birch
age
Society?
group.
It was
And
because I
then,
wanted to be as
the question
intelligent as
about
possible
getting
when it
test
came to what's going
results.
on in
Where's your
politics.
confidence right now, just
I
within
wanted
the
to
state
be
of
with
being
the
able
people who are
to
concerned
get the
about
specimens
America.
in and turn them
I wanted to
around?
be
I
with
just
the
know there's a
people who
woman
were
from Camden
who
who's
wanted
been
to take
just
action in
contacting me.
America.
She's on day
That's why I
9,
became a
waiting
member
for
of
her
the
test
John
results.
Birch
That might be
Society.
an anomaly in
And
the state.
eventually
I'm
they
just curious
hired me,
what
and
your
it's been a
confidence level
great
is right
job
now
because I get to
with getting
teach
test
people
results back once the
Americanism
specimens
all the
received.
time.
And
And
we're
I
not
meet the best
specifically seeking
people
to test people
in
with underlying
Georgia, South
conditions, but
Carolina,
if a
and North
decision has been
Carolina, the
made to
best
test
people that
someone,
are
we
truly
do
trying to save our
recognize
great constitutional
that
republic. And
there
we
is
just
a
gotta,
delay
we
in
gotta put
getting
every
test
effort into
results
taking
back
action.
once a decision has been
It
made
takes
to
work.
test. I reported that
But I know those of you
the
listening
Public
out
Health
there,
Laboratory has now gone back to
some of
being
you already
able to
do the
turn around
work, but there's
tests
more work to be
within
done.
24 to 48
It's not hard
hours.
to do work. It's
But some
fun to
private
do this
labs,
work.
I
It's
understand,
fun
are
to
still
tell
having a
people the truth.
backlog,
It's
and
fun
there is a
to
delay in
get
getting
people to
those
take
test
action.
results
It's
back.
fun to
And that's
point
another
out the
reason why
flaws in
we
our
are
government. It's
looking to prioritize
you know,
who gets
it's
tested, so that
it's not always
we can make
there are
sure
some moments
that
where it's not it can
testing
be
is done for those in
not,
hospitals,
it can be
so that if they're
hard,
negative,
but,
they can
you know,
be
you
moved
can
out
always
of
have a sense of humor
isolation
while
if
you're
that's
doing
not
it, because
necessary, and that's
the
a way
reason
that
why
hospitals
America
can
is
preserve
failing,
personal
this
protective
federal
equipment.
government, our state governments are failing, is because
Yes.
we've
Orders
elected
supersede
people
the local orders
that
already on the
are
books.
Yes.
Does
not
this
even
prevent-
fit to
does it
run our
prevent
small
other municipalities
businesses in
from
our
passing
community.
orders too?
Yes, that
These
is the
people
law.
couldn't even
It
run a
has
small
been the law.
business.
So it
Yes.
And
does
yet
prevent
they're
other
in
municipalities
much
from
greater
passing.
control
That
in
is the
government
law.
position.
That's not
And so
based
we've
on the
got to figure this out as
executive order. That is
Americans.
the law
How do we
of
get
South
out of the mess that
Carolina.
we're in?
Ms. Adcox.
Well, on that note, does that mean, what does that mean for stay-at-home orders by Mount Pleasant, Charleston, Columbia, in your estimation?
I think that again, as we mentioned earlier, staying at home is a very smart practice, and that's what everyone should be doing, as we've said since the very beginning. Staying at home is a good thing to do. It's wise.
Do we have any concrete figures yet for what South Carolina will get from the federal government, and whether our rural hospitals that need help, especially now,
We
might
do
get
not.
some?
We're expecting. We know it's a lot of money. I think it adds up to something like $1.95 billion. But the regulations and such have not been promulgated yet in Washington to determine how that is to be disseminated. But we know it's coming here, and we're ready for it. We're also, the same thing is true with the unemployment money, funds or support coming from the federal government. We're awaiting a lot of that as well.
How fast might it come, do we know?
I think the director, Elsie, at the Department of Workforce said they're looking for some information this Thursday. But for the others, the other funds, I don't know. know. But we'll have to verify when it's going to get here, but I'm not sure that the people writing the regulations know yet when it's going to get here. But we hope soon.
For Dr. Bell, just a couple questions again. I know you wanted to discourage the misinformation, but I'm curious just for first responders, let's say, so not for public use, but for first responders, Are they more aware of specific locations where there might be a hotspot, say, for COVID-19, so they know exactly what type of equipment they should be using when they approach people, protective equipment? Or is that just standard practice anyways at this point for first responders to treat everyone as if they might have, COVID-19 so they can protect themselves from being infected? And then the other question was, do we have data within the state of how many people have underlying health conditions?
So to address your first question, we are setting up a system through a secure database to provide to EMS dispatchers information that they need to make decisions about response. And to your second question, I do not have
I don't really like my
about the
information
number of
being on a
people
state
in
database.
South
I don't really
Carolina
want my health
with underlying
information
health
to be shared with
problems in different
anybody.
categories.
Dr. Bell, I just want to make
I was
sure
at a
understand
doctor's
your point.
office
Does
a
DHEC
few
have a count
weeks ago,
of how
and they
many
knew I hadn't had a
healthcare
flu
workers
shot.
have been infected or tested positive
They didn't
for
ask me. The
COVID-19?
doctor already knew I didn't have a flu shot because I'm not on the database as somebody who had a flu shot.
Thank you.
I don't want my
I'm
information on a
Greenville, and I know
database.
they're considering putting in orders in the city for like 6 feet between people in grocery stores and home improvement stores. So I know you sort of addressed this earlier, but can you directly address sort of what you would tell, city officials in Greenville or the people of Greenville who are considering further restrictions? Literally today they were going to have a meeting on it. So.
Well, I know that those the social distancing and all of those have been the recommendations and the understandings from the very beginning. I think that we should do all to be sure that we should do all we can to be sure that everyone knows that. But the things that are covered in this executive order, of course, are
I'm going to be shutting this down in a few minutes.
And we think that
just want to let everybody know there's a 6 p.m. conference call for South Carolinians who want to take action and protect their God-given rights. So 6 p.m.
But there are a lot of things
the information can be found on our Facebook page, South Carolina
in that area,
citizens, South Carolina Citizens for God-given Rights. So if you type in South Carolina Citizens for God-given Rights, you can find out that information. 7 p.m. we're going to have a mock online.
Yes, sir.
John
What's
Birch
just your
Society
message to the
chapter
people
meeting.
of our state who might be scared right now?
And
as they
I'm
see the
hosting
numbers
it, so
increase?
if you want to
I'd say
take part
have
in
faith.
it,
South Carolina
this is how
has
we're
been
going to
through
win.
everything
Is we
since I
have
began
to
in
get in
1670.
groups, and we have to
We've been
educate
through every
ourselves
war,
and each other,
just
be part of
about
teams.
hurricanes,
It's like a team
tornadoes,
huddle. You get together and you
earthquakes.
talk about what's going on in America.
We've had it all,
and what
and we're
actions
still
you're
here.
taking
And right
to
now, as we
stop
stand
the
here,
spread of
until
Marxism
the
and Leninism
coronavirus took over
and everything
the
that's
national
anti-Americanism.
debate,
So this is how you take
debate
action.
was one
is
of
you,
economics, and
I
South
recommend getting
Carolina
involved in the
is
John Birch
thriving.
Society, no
And
matter
this
where
is
you
a-
live in
this
the
is going
country.
to be a
If
suspension
you live all
of
the
that
way
thriving,
in Timbuktu,
but we're
become
going
a
to get
member of
through
the
it.
John
And the way
Birch
we'll do
Society.
it is by following the rules,
You can find some
having
way to
common sense,
take action
being
wherever
a
you live.
good neighbor, and doing everything you can
it's
to
not, it doesn't
try to
cost much
find the
to
bright
join. It's
side. We all go
$87
come
a year.
out
I know
of it. Our
people right
economy
now are
is
probably having a
going
hard
to
time.
continue. It's going to take a dip.
A lot of people
No
are going to have a
doubt
hard time
about
coming
that.
up with
But
$87
we're
a year.
doing
I
all we
understand
can
that, but just do your
in
best.
this office and
if
the
you can
others that you've heard
participate,
from
if there
to
is an
see that
online
the
membership
least
for
damage is
$49
done,
a year, if you
permanent
come
damage
up with
to
$87 a
businesses
year.
and jobs.
But this is
in South Carolina,
this is how
the
we're
least
going
is
to win. Is
done, but we got to have the
we have
biggest
to
possible
go
impact,
back in time,
and that is
basically,
reflected in the
and
measures that
study
we've
and remember
taken, that are based
what
again
it
on
was like
data,
for these people
science,
who founded America,
experience,
what they
knowledge,
believed
and
in, why
advice
did
of
they
the
believe in what
experts
they
in the
did.
field. Yes,
Why
ma'am.
was it so important that they
repeatedly
believed
said
they
now
had
our people
God-given
follow
rights?
rules, but
How did they
obviously they didn't
identify
at the
that
beach
God
this
gave
last
us rights?
weekend.
Well, they read the Bible. They
Do you
studied
have any
what
numbers
the
of how many
scriptures had
fines,
said,
how many
and they
tickets
said,
have
well,
been written,
this
even just for
it's true.
state law
God has
enforcement?
told
We'd have to
over
verify
and
that.
over
I know
again that
Chief Keel has
we should have
cited
the ability
various,
to have these
various
freedoms.
numbers at times, but he
And
would,
if
he
you
would
read the
have
John
that
Birch Society
information. I'd have to
magazine, you'll
verify
learn this
that
in the
for you.
next issue of the John Birch
Yes,
Society
sir.
magazine. We've got the magazine called The War on Christianity. That's going to be coming out in just a few days. And if you get this magazine,
I think that
just by
that
reading
would,
the cover
that is
article,
not
you'll
what
understand
these
what God-given rights are. And
executive
that's really
orders and rules
so many
contemplate.
people who are
And if
patriots, they
someone
want to
is
fight, but they just
abusing
don't
that
understand
privilege,
the
then
proper
although
way
the public access, as you know, is
to
closed. If
wake people
someone
up,
is
or
abusing
the
that,
proper
then there's
strategies.
yet
If
another
you're using the wrong
law,
strategy, if you
and
don't
that's one
understand
that's
the
been
enemy,
in
you're not going to
effect, like
win.
price gouging
In the
law
John
for a
Birch
long
Society,
time,
we
and
take
that
a
is
close
law
look at what the
enforcement
enemy is,
can
and we work against the enemy.
cite
We educate
and
people.
disperse
We
crowds
play offense.
of
We play
virtually
defense.
any size down to three people
It's a
that
team
are
effort.
posing
And
a
so,
danger
anyways,
to
get
the
involved if you
public
can.
health. And that is what we've implemented by this declaration of emergency. Yes, ma'am. One more.
I'm kind of tired of this
Yes,
news
ma'am.
conference.
Dr. Bell, again,
I think
back
Governor
to Fort
McMaster may be tired
Jackson,
of it too at
for
this
military security reasons, they're not telling people about those reported cases. Does that put the people in Fort Jackson at risk?
So I did not say that they weren't reporting. I said that by law, all providers in South Carolina and labs are required to report. I didn't have specific information about military installations.
I do have a question from a teen journalist for Molly Spearman, if that's okay, that just came to me.
Yes, sir.
She asks, in case, let's see, if DHEC is expecting 8,000 additional cases by May 1st, do they expect to close schools for longer? And if so, sorry, someone was calling me in the middle of that. If so, why not make that announcement now so the plans for end of year can begin to be drafted? That's from a teen journalist.
Thank you. It's a great question, and we hear that question often. As the governor has said, we take this in steps. I'm praying for a miracle. Maybe a miracle will happen, and we will not have to close schools any longer, but certainly at the end of April, mid-April, we'll look at the situation and make the appropriate decision then.
We thank you for coming, and we'll keep you informed.
All right, again, thank you for watching this, everybody that's watching this on social media. We have a 6 p.m. conference call. If you want to get the phone number, go to the Facebook page, South Carolina Citizens for God-Given Rights. Again, that's South Carolina Citizens for God-Given Rights. If you go to that page, the number's available there. You can always call me too. My cell phone number, it's 864-804-0789. Again, that's 864-804-0789. You can call or text me at that number. I hope you do join us at 6 p.m. for our conference call to discuss what we need to be doing to make sure our God-given rights people are aware that we have these God-given rights, number one. But number two is, what are we going to do to work against what's going on? Because a lot of politicians are going to be using this as a repeated action every couple years, every 3 or 4 years. That, you know, if this is, let's say this is not a, let's say this is a man-made virus. Well, if this is a man-made virus, they can make more viruses, right? And so they could do this to our economy every couple years. And if Americans continue to be so fearful of living their everyday lives, you know, we will be in a deep socialist state. And so we have to decide in America, are we going to be the Americans that the founders wanted us to be? They wanted us to believe in these rights that come from God, and they wanted us to believe in having no fear. And you know, they didn't back down from the British, did they? I mean, that must have been a fearful thing. But we're gonna close everything down because of a virus. This is nonsense. This is like dealing with the flu every winter. Why is there not a shutdown every winter for the flu? But anyways, please take action, everybody. And the best way to do it is with the John Birch Society. And if you're in South Carolina, we've got a 6 p.m. call. Anywhere in the United States, if you want to join me for the 7 p.m. call, that's a mock online John Birch Society chapter meeting. I'm going to host it. And so just get in contact with me if you want to be part of it. You can listen in, you can participate, whatever you want to do, but it's good for people to understand what people are doing to take action right now, because a lot of people know that there's something going on. And guess what? The John Birch Society has been right. There's been a grand conspiracy against America since the founding of our country. And we've documented it. We've got the facts, and it's the same enemy as we've always been fighting. And the John Birch Society, if you learn from us, we'll teach you how to identify the enemy, how to work against the enemy, and how to maintain as much freedom as we can keep. So anyways, thanks for watching, everybody. God bless you.